So, guys, welcome back to the Matic Visuals. Today's topic, as you are seeing, is migraine. And if you have migraine or are you suffering from these type of headaches, so this video is for you. Basically, there are so many type of headaches. You can see here migraine, tension, cluster, and sinus. There are so many types, but each other type basically has a reason, a temporary reason to cause pain, and then after some time it resolves. Like tension headache occurs with stress, and if you are relaxed, then this headache also goes away. Cluster headache related to trigeminal nerve for some other reason. Sinus headache, maybe due to the sinus problem or flu that block your sinuses. So, these headaches are a type that eventually will resolve when the underlying cause is resolved. But this migraine is actually very frustrating, and it is genetic, and you can have it through your whole life. It disrupts your daily life to life, day-to-day activities, like your life, your personal life, your professional life. So basically, migraines are really frustrating and annoying. And I have posted a voting system on which next topic I have to make the video on migraine, either on migraine or dengue fever or any other topic like sleeping paralysis. So most of you voted for migraines, and I actually realized yet this is the really important topic, not just for the treatment, but also the people with migraines do want to know what is actually happening inside them that is causing this disruption in their system. So please subscribe to the Medic Visuals if you haven't, and don't forget to like and share the video in the end. So migraine is basically a headache that is intense throbbing pain or a pulsing feeling that is characteristic on one side. So the characteristic feature of migraine is it happens on one side, like you see here. Here I have compared two types of headaches, migraine and tension headache. And migraine is like you see, it's basically it can be felt on both sides, although, but it is more common on one side of the head, and the pain can be felt on the back of the eye, and the people with migraines are sensitive to light and sound. In migraines, you have the intense pain, while in tension headaches, you have the moderate pain on both sides of head, as well as tightness in your head. There is a tightness also. You feel tight pressure. And also there is pain in neck and shoulders. Whenever you are stressed and you are having a tension headache, you will also feel a kind of a stress in your neck and shoulders as well. So these are the major differences between a migraine and a tension. So now coming to the point on a main topic, that is migraine. So in migraine, there is an intense throbbing pain or a pulsing feeling. Like the people with migraine, they often feel much pressure to their temples, and they feel like something is beating like a heart, just like your heart beats. It's something like something is beating inside your head. That is basically on the temporal side, and that can also be an artery that has a pulsation, and basically it's the pulsation that is causing that feeling of pulsing in your head, and you feel extreme frustration and pressure. Also it often happens along with nausea and vomiting and extreme sensitivity to light and sound. So I have just mentioned that extreme sensitivity to light and sound, and nausea vomiting can also be felt along with the migraine. Okay, so migraine attack can last for hours or 2 days, and for some people, there is a warning symptom which is known as aura that can happen before or with a migraine. So, moving on to the symptoms of migraine, migraines can affect any kind of age group, including children, teenagers, or adults. And migraine basically progress through four stages that have different symptoms. The stages are prodrome and aura, attack, and postdrome. So these are the stages of the symptoms. So basically, prodrome. What is prodrome? It can occur 1 day or 2 days before a migraine, and you might notice subtle changes that are the signs or warning of an upcoming migraine. So basically, what is actually happening in prodrome, and many of you guys who already experienced migraines in your lifetime or are going through it right now, they know about this stage that before having a headache, they are going through these things which I have mentioned here. Number one is constipation. You may have constipation, you may feel constipation or changes in your stomach. Then there is mood changes. Mood changes can from depression to elation. Means from depression sometimes you're feeling low, and then the other time you're feeling extremely happy. You can have food cravings, just like you are experiencing some kind that you actually need to eat something sweet or food or cheese or burger. You have neck stiffness. This is also a characteristic symptom of a prodrome stage. Increased urination. You have the urge to urinate again and again. Fluid retention, just like the puffy eyes, it means that you are having the fluid is retaining inside you. Frequent yawning. So these are some of the things in prodrome stage. Now the second stage is aura. Aura is something that can occur before or during migraines for some people. Auras are reversible symptoms of the nervous system. They are not permanent and they can be reversible. They are usually visual, but they can also include some other disturbances. And each symptom usually begins gradually and build up over several minutes, up to 60 minutes. So the examples of migraine auras are visual changes, first of all. So visual changes include like seeing shapes and bright spots, yeah, or flashes of light. Other than that, there is vision loss, and you can have a tingling or feeling of pins or needles in your arm and leg. You can have weakness or numbness in face or one side of the body. Also, you have trouble speaking. So this is aura, and to remember it, it can occur before or during migraines. Now, the actual attack when it happens, so the actual attack is basically migraine usually lasts from 4 to 72 hours if it's not treated. And it varies from person to person. Migraines might occur rarely or strike several times a month. So it is also different from person to person. In some people, it occurs more frequently, while in other it occurs rarely. So during a migraine, there is a pain usually on the one side of your head. Okay, although it can occur on both sides, it's not strictly restricted to one side. And pain that throbs or pulses, that actually that gives you a feeling of extreme throbbing or pulsing discomfort. Also, there is sensitivity to light and sound, and sometimes to smell and touch as well. Also, there is nausea and vomiting. So, these are some characteristics of the actual attack. Means one side pain, throbbing or pulsing pain, sensitivity to light, sound, and sometimes the smell and touch, and nausea and vomiting. These are the four characteristics. Now, there is post-drop. Post-ROM, then once the migraine attack is over, you might feel drained, like you have worked a lot, you have put an extreme amount of effort, you are feeling drained now, confused and worn out for up to a day. Some people report feeling sad, or some people report feeling elated. Also, sudden head movements can bring on the pain again. So there is a cautious need to monitor your pain as well in the post-ROM stage. So, coming on to the next point, when to see a doctor. You need a doctor when migraines are shaping like this. Migraines often not diagnosed or treated. If you regularly have symptoms, you keep record of your attacks and how you treated them, then you make your appointment with your healthcare professional. And if you have a history of headaches, so you have to see your healthcare professional. If the pattern changes or your headaches suddenly feel different, so you have to monitor the pattern, that if something feels different, there is something wrong and you have to get checked immediately. You have to go to the emergency if you have one of the following symptom, just like an abrupt or very bad headache, like a thunderclap. So basically, if you are a patient of a migraine pain, but you are having a sudden and a very worse headache, so you have to see the doctor, or you have to go to emergency room. Also, headache with a stiff neck, fever, confusion, seizures, double vision, or numbness or weakness in any part of the body, because these signs or symptoms indicating towards a stroke. They can be the sign of a stroke, so you have to go to emergency if you are having these all things along with headache. If you are having a headache after head injury, that is really something very important, and people often ignore it. Sometimes we suffer through minor injuries in our homes or outside the home. We just go to emergency or to the doctor after having a major accident, but sometimes there is also a possibility that you have hit your head somewhere, and we take it very lightly usually. We don't take it seriously that I hit my head or what's a big deal. But sometimes it is a headache after an injury, and this is something serious. Or if you are having or experiencing seizures or vomiting along with that headache, this is really serious, and you have to get evaluated yourself to know if there is anything internal inside, like internal bleeding or stroke or clot forming. This is really necessary to go to emergency after a head injury to evaluate your headache. Now, a chronic headache or a long running headache that is worse, that is getting worse after coughing, exertion, straining, or sudden movement. So, it is also necessary that if you are having a chronic headache, a long term headache, and that is worsening on physical activity or sudden movement, it is also an emergency indication. After the age of 50, if you are experiencing a new headache pain, this is also a sign to see emergency, because this is not something normal after the age of 50. So these are the some things on upon which you have to see the doctor immediately. So if we are going to talk about the causes, because many of you experience this worst kind of headache and you want to know what is happening with you and why this is happening to you. So, migraines actually are not fully understood, and genetic and environmental factors play a role. Sometimes there are changes in the brain stem. This is midbrain, pons, and medulla. This is the mid brain stem actually, and there are sometimes changes in the brain stem and its interactions with the trigeminal nerve, whose nucleus is in the pons. So basically, trigeminal nerve, which is a major pain pathway, that's why interaction with trigeminal nerve might be involved. Imbalances in brain chemicals also might be involved, including serotonin, which helps regulate. This is serotonin, and it helps regulate pain in your nervous system. So, if there are brain chemicals involved, there can also be a chance of migraine. Other chemical messengers play a role in migraine pain, which includes CGRP. So basically, you have to remember this CGRP. It is the abbreviation of calcitonin gene related peptide. And this is the chemical messenger you have to understand for a migraine. So basically, now I'm going to talk about the triggers of migraine pain. What triggers it? Because it is really necessary and it comes from your daily life routine and lifestyle. The triggers. So you have to manage it or control it. Number of things that can bring on a migraine. First of all, it include the hormonal changes. If there is a fluctuation in estrogen levels, there tend to be a migraine. So, estrogen. You have to remember the name of this hormone, which is a female hormone, because the fluctuation in this hormone levels extremely affect how your migraine or headache behave. And this can happen before or during the menstrual cycle or during pregnancy and menopause. Hormonal medicines such as oral contraceptives, this is also something to remember and to uh, make your mind about it, that the oral contraceptives disrupt the levels of estrogen. There is a hormone free period which can trigger migraine. The next one is alcohol and caffeine. Alcohol, especially wine, and too much caffeine, like in coffee, can trigger a migraine. So, caffeine enjoyable by most of us, and we cannot most of us cannot work without it, but we have to keep in mind that these are some of the daily life to life and day to day things that you do without keeping a track of it, and this can cause or trigger your migraine. Now the third thing is stress at work or home, it can cause migraine. Sensory stimuli, as we have all talked about, that bright lights or sunlight, even in extreme hot weather, the direct sunlight can trigger migraine, or the loud noises. Strong smells can trigger migraine in some people, because there is a smell pathway or factory pathway These smells include perfume, paint thinner, secondhand smoke, and other triggers. So these are the very strong smells that can trigger. Sleep changes. Now, sleep changes do not include insomnia or just not sleeping. It can also include too much sleeping. So missing sleep or too much sleeping both can trigger migraines in some people. Physical strain, any kind of strenuous physical activity. Other than that, there is weather changes. Also, the change of weather or a barometric pressure can prompt a migraine. So, weather changes are also affecting your migraine. Medicines like oral contraceptives and vasodilators. What are vasodilators? That dilates your vessels, that widens your vessels. So, such as nitroglycerine, they can aggravate migraine. So, you have to write nitroglycerine. You have to memorize the name of this drug or the vasodilator in the case of in scenario of migraine. Now foods. In foods there is aged cheeses and salty and processed foods. They can also trigger your migraine. And skipping meals can also bring on a headache. Now food additives, sometimes the sweetener and the preservative monosodium glutamate called MSG. These additives These additives also cause migraines and are present in many foods, so you have to be really cautious about it. So, now talking about the risk factors. When you are at risk of migraine, there are several risk factors making you prone to have migraines. First of all, family history. If it's running in family or any member of your family has a migraine, means you have a higher chance of developing the migraine. Age. Migraines can be at any age, though the first often occurs when you are a teenager. In teenage, you mostly most of the people experience it first time, and it peaks during your 30s and gradually becomes less frequent. So it's a good news that it can gradually become less frequent. Now, in case of gender, the females are more prone to migraines. Why? Because of this hormone estrogen, which I have already told a few minutes ago about it, that the estrogen fluctuation, because estrogen is a hormone that flows through the woman's body in abundance and it declines during menstruation or pregnancy. So that's why this hormone fluctuation significantly affects the occurrence of migraine. That's why in females it is three times more likely than in men to have migraine. Hormonal changes, that migraines can begin or just before or shortly after your menstrual period. So hormonal changes have this much effect on your migraine, and they might also change during pregnancy or menopause. And migraines actually generally improve after menopause. So these are the things to keep in mind, some things. Now, if talking about the complications, that some people with migraine having complications due to the medication overuse headaches are can lead to a painful cycle, and if medicines do not relieve pain and begin to cause headaches, then you might try taking more pain medicine to find relief. Then this is a painful cycle, and you are going through it again and again. Medications you are taking for your headaches, taking painkillers too often can also trigger the headache. So you have to be cautious about that also. Medication overuse headaches may occur if you take aspirin or ibuprofen for more than 14 days a month. So you can take painkillers for your migraine, but you have to keep track of it. If you are taking aspirin or ibuprofen for more than 14 days a month, it can cause medication overuse headache, or they can occur if you take medicines known as triptans for more than 9 days a month. The risk is highest with medicines that combine aspirin, acetaminophen, and caffeine. So this combination is strictly needed to be monitored. Back to the treatment, what you can do to avoid this headache. There are two types of treatments: acute or abortive migraine treatments that helps to stop an attack, or there is preventive. So if you want the treatment for acute or abortive, so we are talking about the treatment, and for acute abortive migraine treatments, there are these are taken at the first sign of a migraine to alleviate pain and symptoms. So basically these are for the pain and its symptoms alleviation. First of all, there is triptans, and The second one is OTC, any or means over the counter pain relievers, which include ibuprofen, aspirin, and combinations like caffeine, aspirin, and acetaminophen. Now, the next thing is CGRP, which is CGRP inhibitors, which I have already told you about that these are the oral medications, and they inhibit CGRP, this chemical which is triggering the migraine. The next one is Dietins, and it is a newer option that actually targets the headache pain without causing constriction of blood vessels. Ergotamines, these are effective for long lasting migraines. So, ergotamines. Then there is antiemetics. Antiemetics for nausea and vomiting. These are basically for your nauseatic feeling and to treat it. Now there is second, preventive or prophylactic treatment. So what is preventive or prophylactic treatment? It actually reduces their frequency. They are taken daily or monthly to prevent attacks, especially if attacks occur more than 15 days a month. So first thing is CGRP monoclonal antibodies. CGRP monoclonal antibodies, and basically these are injectables. Then there is botulinum toxin, and this botulinum toxin is used for chronic migraine. Blood pressure medications, this is very necessary, and basically the people with migraines are often evaluated for blood pressure, that either they are the patient of blood pressure having high blood pressure constantly. Also there are antidepressants for the prophylactic management, and there are anti-seizure drugs because seizures can be caused by migraines, and supplements like riboflavin, means vitamin B12 and magnesium. So these may be recommended by the provider. Now if they are talking about the non-pharmacological treatment, means that doesn't involve the drugs, there are neuromodulation devices. Basically, these are non-invasive devices that send electrical signals to the nerves to block pain. So there are a pain reliever, and lifestyle changes that is really necessary, including proper hydration. You have to drink lots of fluid, you have to take lots of water, and you have to maintain your sleep cycle properly. Take regular meals, avoid cheesy and processed fruits, try to maintain your blood pressure and stress, all those things which are risk factors and causes. If you manage them, those, so these are the lifestyle changes for negating the migraines. And the last one is behavioral therapy, that is CBT or cognitive behavioral therapy or meditation. So these are basically the remedies for treating your migraine. So guys, if you are a migraine patient or having a migraine throughout your life, so you guys tell in comments that what you feel, and the stages I have told about you. Have you experienced that stages like this is aura and prodrome, aura, attack, or postdrome? Any of these stages you experience, and or if all four of them you have experienced in your lifetime, you have to tell us in comments. You have a query, post your query, and I will try my best to answer you. So this is all about migraines. In the next video, I will come up with a second topic, and it can be something I will talk to you guys about it. So stay tuned with the Matic Visuals.